After my last video, I had a lot of questions, and there were about 5 questions. I'm going to take 5 minutes to answer 5 questions. I started my timer. First question, what about blood types? Well, type A seems to be associated with worse disease. In a study by the New England Journal of Medicine in cases in Italy and Spain, they looked at their entire genome and found associations. They found 2 genes, and one of those was the ABO complex, and A seemed to be worse than O. O actually is somewhat protective for severe disease on COVID-19 illnesses. What's pool testing? Question number 2. Pool testing is when you take many people's samples for SARS Cov-2 and you put them all together and you test it. Now, that works because it's a PCR. It looks for any DNA in a sample and it amplifies it and it analyzes to see if you have it. Now, if nobody in that pool of people has COVID, you can say that everybody's negative and it saves tests. So if you took 10 samples, so these are the nasal swab samples that are taken for acute COVID-19 illness. And if you take 10 of them and put them together and run them all together at the same time and it comes out negative, everybody in that group is negative. Now, if it comes out positive, they have to go back and they have to retest all 10 of those to see who was positive. That works well if there's not a lot of illness in the community, and that's really the case right now. So pooled testing, if you hear about that on the news, actually a good thing. It's going to save tests. Third question, aerosol versus droplet. Whenever you cough and talk, how does the virus travel? The fact is, most of the virus travels as a droplet, and face coverings will block it. Aerosolized is when a particle is by itself and floating in the air. So how much of the SARS-CoV-2 virus is floating by itself in the air? The reason that's important is because most face coverings can't stop that small of a particle, a viral particle, from going through it. But the reality is, yes, it's possible that some of the virus might be aerosolized. Most of it's in droplet, and a good face covering cloth or a surgical mask will stop most of those droplets and stop the vast majority of virus that will spread from your nose and your mouth. Okay, are the numbers overinflated because of more testing? Yes and no. Yes, there are more tests, and yes, there are more numbers, so it looks worse. Is that overinflated? No. It's just a more accurate picture of what's going on right now. Yes, a lot more of those are asymptomatic cases. Here's what we could look at that's a little more accurate: the number of hospitalizations and the number of deaths from COVID-19. That number is not a bad way to judge policy decisions, and if we're getting worse. We're getting worse. The United States, the death rate is climbing once again. It did go down in April and May after hitting a peak in May, and it continued to go down until June and early July when we started to open things up. The infection rate went up, and it's gone up sharply in the United States to about 70,000 new cases a day, and now our death rate, which was down around 3 to 4 to 500 a day, is now reaching 1,000 a day. It's still lagging behind the infections. When you see the infections rise, about 2 weeks later, you'll see the hospitalizations and the deaths rise. Okay, are the numbers reliable? Are the people counting it reliable? I looked at about 4 different sources for numbers on COVID-19 illnesses. One of those is the New York Times. What is the job of the press? It's to keep governments in check and to watch them. They're watchdogs. They want to get accurate numbers and inform people about that. All right, say you don't believe the New York Times, even though that's their purpose, to give accurate numbers. Go to the academics. I usually look at the Johns Hopkins site, and this is done by their Center for, forgot the name now, I'm losing time. The Center for System Science and Engineering. That dashboard is academics working to get data. The COVID tracking project, that is also run by volunteers, and it looks at data from all over. The CDC, they get their numbers from state and from county health departments. The thing is, all 4 of those resources have very similar numbers. they're not inflating their numbers. If you want to look at 4 different institutions that have no reason to inflate their numbers, look at those. The numbers are increasing. The peak in April was about 30,000. That's my alarm going off. I went over dismiss. I went over 5 minutes. All right. Another question I was going to go over was, won't the lockdown cause more financial damage than the virus? And this is the idea that the shutting down business is causing more trouble, which it does. If we lose our jobs, we lose our money, we lose our homes, people are homeless, they don't have food to eat, that's a bad thing for our society. So isn't shutting down businesses and lockdowns more damage than the virus? Here's my point. Once this became a pandemic, financial damage was a given. There's no way you're going to have a pandemic without having some kind of financial hit. The only question is, are you going to have financial damage and a lot of death, or are you going to have financial damage and minimize your death? And think about it the other way. If we just let this go and let it run through our country or the world, then you would have people staying home because they're sick, people staying home because they're dying, and people not wanting to go out and do commerce because of the virus being out there. One way or the other, a pandemic is going to affect you financially. It's better. In fact, we'll get over this quicker by limiting its spread than by just letting it go. So, no, the lockdown didn't cause the financial damage. The pandemic did. Okay, I hope those helped you. Those are the questions I got this week. Have a great week. I'll be watching the news and I'll be watching medicine for you.